On the Medical Watch, the language of medicine.
WGN's medical reporter Dina Baer tells us about a COVID-19 complication, a new one.
Sometimes it's not just about translating complicated medical terms into words people can understand. It's about knowing how to respond to every patient in a multicultural city like Chicago. For Rush University Medical Center, that meant speaking 65 languages in the pandemic. In a city where 30% of the population speaks a language other than English, hospitals have become the epicenter of the melting pot during the COVID-19 outbreak.
There's about 150 languages spoken in Chicago.
您好.
Hola.
Guten Abend.
It's a very multilingual city.
Rush University Medical Center interpreter Carlos Olvera and his colleagues are typically called on to assist patients in 10 to 15 languages a day. During the pandemic, that number jumped to 65.
The top 5 languages that we provided, requested were Spanish, of course, number 1, Cantonese, Polish, Mandarin, Russian. We have Arabic.
With no family members and limited hospital staff at their side, patients rely on interpreters to help guide them through diagnosis and treatment.
We were getting calls from family members who had just dropped off their loved ones in the ER and had no idea what was happening to the family member. They knew that they didn't speak English, and so then just added the stress. So we would assure the family members that, we had the services, that the family member will be provided, services will be given in their language, so not to worry, kind of to put them at ease.
Instead of the standard bedside hospital phone, Carlos and his team employed this system to set up a 3-way conference call between the caregiver, patient, and interpreter.
Thank you for calling InterpreTalk. Press 1 for Spanish. Press 2 for all other languages.
So the dual handset phone helps us kind of put a distance between our provider and our patients.
Hospital staff can also roll in a secure iPad for face-to-face communication with a sign language expert or a video remote interpreter like Carrie, who speaks 7 languages.
I speak Mandarin, Cantonese, Shanghainese, and Spanish, and Japanese, a little bit German and French.
It's not just a language barrier that's challenged patients and interpreters during the pandemic.
In the COVID-19, the situation is even more difficult because at the beginning, the message or the information was not very clear, and the people didn't really understand it well. So the patient was terrified of many things.
It's a critical service at a critical time. For some patients, their final lifeline to the outside world, particularly if the patient is put on a ventilator. A communication gap can be terrifyingly confusing.
Part of the instructions then that the provider will give the patient is for them to contact their family and start saying their goodbyes, because there is a chance that the patient might not come off of the ventilator. Yeah, at the end of the day, we are proud of what we do.
Carlos and his team say it's not just the bad news they have to interpret. In the best scenarios, they also get to tell patients they're going home. Back to you.